Hi, I'm Katie Crane, and this is the Pilates Lounge. Hi everyone, my name's Katie Crane. I'm the Pilates professional. Welcome to another episode of the Pilates Lounge Podcast. Now, this year we're rolling out things a little bit differently than what we have in previous seasons. I'm going to be touching on specific topics, and we're going to end up doing a series on that particular topic where I'm going to speak to movement professionals, scientists, people living with conditions, so that we as Pilates professionals can really learn how to better serve particular populations within the Pilates studio. So I figured that this year we couldn't have any better guest with us than the wonderful Carla Mullins from Body or Organics Education. You probably, if you're in Australia or even if you're international, you probably know Carla's work. She is definitely at the forefront when it comes to looking at complex conditions, specifically in the Pilates studio. Carla is very curious. She's great at problem solving, and she tends to love puzzles. So I figured that I would get Carla on today so that she can share her perspective of working with people with fibromyalgia, and we're going to talk about that a little bit more in depth, or a lot more in depth. But also, Carla lives with a condition herself where she can really relate to people and empathize with people living with such a complex condition. So welcome to the show, Carla. Thanks so much for joining me.
Thank you. It's always a pleasure, Katie. It's always a pleasure. Fibromyalgia, when you asked me about it, I just went, yeah, that's really an important topic. And I feel like when someone says, well, what happens, what's the first thing you think of when you're working with a client who's got fibromyalgia? I always think, this person's probably got a master's in medical gaslighting, especially if they've had it for a long period of time. It's one of those conditions that over the years, understanding and attitudes changed. So, and it's one of those confused conditions as well. And so when we talk about it, I think it's kind of nice to know where we've come from and where we are now, even in just understanding what the diagnosis is. So,
right. And so, why is that? Like, explain that. Please explain.
Okay. Well, I sort of think part of the problem comes from one, the definition of fibromyalgia has changed over the years. And probably the definition that has settled in Australia, the US, UK, and most places in the world sort of started to really settle around 2019, 2023. And that definition really is that it is a chronic, long-term diffuse pain syndrome with other conditions such as fatigue, sleep disorders, cognitive issues like brain fog sort of stuff that have lasted for more than 3 months. Okay, so that, like, when you think of that definition and think of that sounds like a bundle of symptoms that could be a result of many things. Mm-hmm. So on top of that, not only do you have like this bundle of kind of vague symptoms, it is also a condition that is more likely to impact women. So, of course, because it's mainly seen as a female issue, it probably hasn't been taken as seriously with the medical profession. I could be wrong, but, I think a lot of people who have the condition will say they have had a lot of trouble getting taken seriously. There's been confusion and overlap about what their symptoms are, what the condition is. Then on top of that sort of whole bundle of stuff, it for many years, so start back like around 2010, 2011, the condition was suddenly sort of recognised. Okay, so it was a long period of time. It wasn't something like just happened. It was something that existed for a long period of time, but no one believed it existed. And you could put it in the bundle like chronic fatigue syndrome, fibromyalgia, lots of different conditions that have been sort of dismissed in some ways. They are different conditions, chronic fatigue and fibromyalgia. There's no dispute. They are different conditions, but they overlap in the symptoms. So what happened way back in 2010, 2011, really wasn't that long ago, but it feels like a lifetime ago. The recognition was that there was this condition that was characterized by trigger point pain. And so there were these trigger points in the body that was seen as an area of sensitivity, and that was likely to be a reason why somebody has fibromyalgia. So those trigger points were around the neck, the torso, the elbows, the hips, and the knees. So the trigger points were in those sorts of areas. And one of the ways doctors would sort of deal with it was like a point. They'll poke you. Oh, that's painful. Great. But they didn't really take into account all the other circumstances that were contributing to this. Okay. But it was a diffuse pain syndrome, basically. Now, in the last, I would say 20 years, our attitude and understanding of pain has changed dramatically. And slowly this understanding is, well, just because you've got the trigger points, that may not necessarily be the cause of pain, but what may be contributing to this pain. And over the years, they started to take into account more and more considered ideas. And then in more recent years, they put together a sort of a questionnaire or sort of a survey to make an assessment of where somebody is. Do they have fibromyalgia? Now, the other part of the story is up until about 2023, roughly, give me a couple of years either way. Up until about that point, the attitude was that fibromyalgia was a differential diagnosis. So fancy words, what essentially means is we have no idea what's going on. We've ruled out all of these things, so it could be fibromyalgia. Kind of explains why sometimes people who have had this condition feel like they've been gaslit because they have gone through so many assessments and they've had to tell their story to so many doctors and they've had to see this person, that person. And there are all of these gatekeepers that are saying, so you're tired a bit. Oh, okay. And you've got a little bit of pain and you're not sleeping well. Have you thought of taking a holiday or managing your stress? And yeah.
You're muted. Have your AirPods run out of battery?
Can you hear me now?
Yep.
Okay. So there's this consequence was that for a long period of time, people going, well, it took a very long time to even get an idea of a diagnosis. But there was also this sense of, come on, is it all in your head? And so it was bumped into all of these categories. Now what happens is fibromyalgia, sort of they have a little questionnaire and they sort of consider these factors. But what you have to also remember is that a lot of the time that these factors are occurring, it may be considered primary fibromyalgia or secondary fibromyalgia. So the big difference is secondary means that sometimes this bundle of symptoms, the fatigue, pain, sleep disorders, brain fog, depression, may be symptoms that have flown from other conditions, particularly rheumatological conditions, which again are more likely to impact on women. So you're thinking there's some recent studies showing in some conditions, and I think it's psoriatic arthritis, 18% more likely to have comorbidity or fibromyalgia, rheumatoid arthritis, or ankylosing spondylitis. All of these conditions have a high likelihood of somebody also having this condition. And then it becomes a little bit confusing for these people who are getting this diagnosis. Oh, so am I getting the general pain, the fatigue, because of my psoriatic arthritis, and therefore I need to change that treatment? Or is this a different condition that I have to get treatment, and my underlying condition is still okay? That makes sense.
Yeah.
So the short answer is, when somebody comes to you and they've told you they've got fibromyalgia, you've got a couple of factors that you're thinking about. First of all, the person's experience of the medical system. Okay, so they're going to be coming to you probably after they've tried a lot of things. And they're the people who, they're probably a little bit on the desperate side, just because they feel like they haven't been listened to. And they're probably going to be a little bit superstitious, and they need a little bit of validation. Saying, okay, what you're saying, that is true. This is your experience. Let's understand the symptoms and what the experience means for you. So it's my first point, is the type of client, their actual experience and journey before they've even come to you. So from a Pilates teacher's perspective, my first thing is making sure I'm always taking the time to listen to their story. My second factor that I'm going to be looking at is they could have a whole variety of other symptoms and conditions that are also compounding this. And trying to unpick all of that is probably beyond the scope of your average Pilates teacher and probably your average person. Really, they should be working with a rheumatologist on this sort of stuff. But what you're wanting to understand is their symptoms and their experience and how that impacts on their function. So that is how they participate in daily life. Because that is truly the magic of Pilates. Because a truly structured Pilates practice and Pilates program can help somebody break down movement and relate it to the activities they want to do. So that's why I spend a lot of time with my clients getting to understand what's going on. Probably one of the first questions that I would say ask them after I've listened to them is, so is there something that you would like to do that you feel you can't do because of these symptoms? And when you ask a question like that, you actually open up the opportunity for someone to have a discussion with you about what they would like, what's important to them, so that you, when you start working with the program, can have an opportunity to think, well, what can I give this person that will support them? So that could be gardening, it could be whatever they want to do. You can do your task analysis of those activities and think about how that can match to what you do in the Pilates program. The third aspect, so we're talking about clients, who the client is, their experience, the gaslighting, all of that, about how it's impacted on their function and all the other conditions. The third aspect is their fatigue. Okay? Now, this is the biggie, because most people think, oh, fatigue. Oh, just have a little lie down and you'll feel better. Have a holiday. The reality is that when you're experiencing fatigue from a medical perspective, it is a type of tiredness or exhaustion that you do not feel refreshed from after sleep. So you wake up tired, and that fatigue and energy levels impact on your capacity to think, to organise and do everyday tasks. So as soon as I hear someone's got possibly fibromyalgia or any condition where fatigue is an issue, I'm going to be thinking about how do I manage fatigue in that studio setting. And some really simple ways that I can do that are, one, the timing of the day. So if my client is coming to me for a class, they're going to need a certain amount of energy to participate in that class. And if they've already got some deficiencies in their energy, they already don't have that much in the bank to start with, having their class at the end of a busy day is probably not going to help them. So you're going to talk to your clients about, well, let's think about your timing. When do you feel like you have the most amount of energy? When do you think we could do this class so that you don't have all of these other competing demands? So is there a day that you don't have to pick the kids up from school, do the housework, go to work, whatever? Let's find those days so that we give you an opportunity to pace yourself and give you that little bit of extra, what I would call energy bank. Okay. I'd also be asking them about, well, how can we pace yourself in a class? So this is where it gets kind of tricky and demanding for both the client and the studio. I will generally work with my clients on pacing the time, how much time they commit to their Pilates class. I've had some clients who have come in for 15-minute sessions. We do a certain amount of work with them, give them some ideas, and then that's it. Because if they did 20 minutes, they push themselves so far in their energy demands. They might be in bed for a week, which is not a great outcome. So we work on what is the optimum amount of time that we can work for this client. So some clients I might start with 15 minutes. I really try to work for half an hour, to be honest. If we can get to a half an hour, I feel like it's great chance for that person. I generally will not start a client who has fibromyalgia diagnosis or suspicion of fibromyalgia with more than a half hour. So I want to manage their fatigue, and I don't want to push them so far that they're so exhausted they can't do anything for a couple of days. Okay, because that's only going to further the condition though. With me? The next thing about fatigue and the overlap is there's a lot of fear about exercise or movement because there's a history of I've overdone it, it exhausts me. And it only makes things worse. I might just have a chat to them about it. I said, well, look, I understand where you're coming from. And that's about how we manage your fatigue. But we also had to prevent what's called your deconditioning. So because if you don't move, you don't have any exercise, your cardiovascular conditioning gets less, your muscles become less efficient, and therefore that makes you more fatigued in some way. And a few years ago, there was a Cochrane study review, and I think, Katie, I can share that link to those people who would like to have a read of that. And the Cochrane meta-review was on exercise interventions as part of a strategy for fibromyalgia. And there was evidence that a lot of people benefited from a 12-week exercise intervention on the proviso that the intervention was paced, was staggered and progressed at clients' requirements. There were some problems with the review. It didn't really do any follow-up. Okay, so it didn't identify compliance with that test or intervention after 12 weeks.
Mm-hmm.
And I think that's really important consideration, because sometimes what people can do is they might be able to get through a term, getting better and getting better. But to be honest, any intervention from an exercise perspective has to be really quite long term. We're talking years of maintaining function, activity, slowly and progressively getting people from their deconditioned state. And so this was part of that study. But it still is recommendation that exercise is a great intervention for this. And some of the activities, some of the exercises that were looked at were yoga. There wasn't actually included in that study Pilates, but other recommendations have said Pilates is very good for fibromyalgia. My question from the yoga studies was it didn't explain which type of yoga was used. So, for instance, if yoga is a very broad term, and I think, right? Was it hatha yoga, which can be quite a gentle, neurologically calming system, or was it hot yoga? My suspicion is that it's probably going to be the former, the hatha yoga, and I can talk a little bit more about that. So in my studio setting, I'm looking at my timing with my classes, I'm looking at how I'm going to progress my clients, and then I'm going to be doing some real planning for my exercise choices and outcomes. Any questions so far, Katie?
I've got a few. So before we move on, do you know, so in general, so you're saying, like a lot of people have gone down a long pathway before they even get diagnosed, right? Because they're presenting with some really common symptoms that a lot of people have anyway until, they do the whole questionnaire. So do you know how long does a diagnosis generally take for most people? What's the average, do you know?
That after the question of how long the diagnosis takes is a really interesting, it's quite a challenging question. Because for you to even have the diagnosis, you have had to experience the symptoms of diffuse pain, sleep disorders, fatigue, and thinking problems, cognitive problems, for a minimum of 3 months.
So do all those things, like for somebody who's experiencing fibromyalgia, do all those things come about all at once, or might you start with fatigue and then something else might stack up on top? Is that kind of how it happens?
It can happen. So again, not everybody will have pain, but they may have some pain and some trigger points, but pain may not be the primary reason they've gone to see the doctor.
Mm-hmm.
And so I haven't seen any studies on how long it can take, but my gut says you probably take looking at least a year before someone's even going to go to the doctor to be raising these things. Like, I go to the doctor, I'm getting fatigue, they suggest, why don't you take some iron tablets, some vitamin D. I'm not sleeping well. Have you thought of doing, you know what I mean? It's the symptoms can be kind of that vague that it takes a little bit of time for everybody to work things through. And I had a few clients who had rheumatology conditions. So it's psoriatic arthritis, rheumatoid, one of the 100 types of arthritis. A lot of them will even tell you, even just getting their initial diagnosis of, especially something like psoriatic arthritis, can take a couple of years because there's this vagueness about the symptoms. And so you have to go through all of these tests, there's these blood tests, there's go for x-rays, goes for this. And the reality is that for something like fibromyalgia, there's no quick blood test. Okay? So, but something might come up in the bloods that go, they're on the edge of this inflammatory condition, but we can't kind of work out. So I wish it was easy to say, it will take you from low to go to get the diagnosis. But my suspicion is that when you work with a client with fibromyalgia, they'll probably tell you at least a year if they were lucky.
And I feel like it really takes, from the clients that I've worked with, it takes them being the detective to end up with that outcome, because if you've got something wrong with you, ultimately we just want an answer, right? That's part of us moving forwards. And that's what I see is people who have finally got the diagnosis, they've really pushed for a diagnosis of something, and they have to keep going to see so many people for a long period of time to even get heard.
But sometimes I feel like you resorted to the childlike thing of, but why? But why? And it's a constant process. And look, I've met some great rheumatologists over the years who are really supportive of that process. But what you'll find is that people then get this diagnosis, and then all of a sudden these other things start coming out. And the puzzles are starting to come together. And what I say to my clients when they're coming to me, even if they don't have a diagnosis of fibromyalgia, but they've got this syndrome of symptoms, I say, let us not at this stage worry about the why. Let us ask, how does this impact on you? And what can we do in this environment to support you to improve your function? And so I try to say, look, I understand, you need to understand why, but that's not my role. My role is to help you with what and how do we help you create a more functional life, managing your life and managing your life to do the activities you want to do, so that your life isn't just a series of medical appointments. Because quite frankly, that's pretty soul destroying in itself.
Yeah, for sure. So people get diagnosed by a rheumatologist. That's where the diagnosis come from, or that's who the diagnosis comes from, right?
Yeah, generally they'll get sent to a rheumatologist. In some countries like the UK, some physiotherapists can give a diagnosis. In Australia, allied health practitioners cannot give a diagnosis. They can make recommendations. And, even someone like myself, I will always say to people, I think you should try and pursue it. I'm not saying I think you should. Have you considered going down this path and trying to have a good, well-known rheumatologist I know that's good at listening, good at supporting, and help them understand that. And sometimes with some clients who I've got long-term working relationships with, I help them work through how they might even talk to their doctor about what's going on. Because if you stop and think about it, as a Pilates teacher, I may see a client an hour, 2 hours a week. Even if it's 3 half-hour appointments, I'm still seeing them for at least an hour a week. The average doctor's appointment would be less than 15 minutes. So you have to have a lot of information organised for your doctor to be clear to help them even understand what's going on. And as a teacher, I'm observing the person. I'm seeing that person. I've built a trust relationship with them, and they're going to tell me things. So, okay, when you talk to your doctor, do you talk to them about this? And they go, oh, no, is that relevant? I'm going, well, yeah, it could be relevant. So there's a questionnaire that came out around 2023, and I'm happy to share that with you. I'll send the form so you can put that in the show notes. And in these notes, this form looks at two aspects. There's what we call the symptom severity scale, and then the pain index. Okay. And I think this has probably been a really good way of helping your clients or these patients get better outcomes, because instead of just looking at pain, they're looking at the severity of the symptoms and starting to think, well, how does that impact on that person's function? So there's generally like a symptom severity scale where pain, fatigue, thinking, or thinking and remembering. And people rate those scales. I think it's from between 1 and 3, I think the scale is, of severity. And so they get a little score from that. So this is the symptoms and how that's impacting. Then the person also is asked questions about where the pain is. Remembering that in something like fibromyalgia, the pain is diffuse. In other words, it's in a lot of different places, and it can be really hard to pinpoint. And it's sort of starting to take it a little bit more away from the idea that this is a trigger point, which, there's different people that say, trigger points don't exist, and other people say, or whatever. So let's not get into that argument, but saying there's rough areas where this is a problem. And so this widespread pain index that they look at is they ask the person to identify, is it the left upper limb, the right upper limb, the lower left, the right lower left, and then your axial skeleton. And part of the reason they're going to ask that is fibromyalgia, as with many inflammatory rheumatoid conditions, will generally be on both sides. So it will be both shoulders, both elbows, both knees. And so what they do is they get the client to say, and the more ticks that you have in those body regions, and I think it's around 7, I'm sorry, I can't remember exactly, I think it's around 7 and above, they'll go, oh yeah, this is looking like fibromyalgia. And so sometimes this is sort of used as a bit of a screening tool to say, off you go, see the rheumatologist. And I think it helps people then start to think of, oh, actually, this is more than just pain, and starts to prompt people to ask about some of these other symptoms.
Okay. So you recommended, you said that quite often you work with people for as little as 15 minutes, and then, I'm thinking as they get stronger, then potentially they can start to do more, or as you get to know what their capacity is and get feedback on how they respond, then they can stay for longer. Do you find, then what, and then do you find that those people end up, in your case, you end up with them in a semi-private or in a mat class or ever in a reformer type class? What in general, and I know that that's, there is no in general.
Yeah, no, in general. I find that these clients generally do best in semi-privates.
Sure.
Or small mat classes.
Yeah.
Okay. I do end up with a lot of people in this sort of category who have come to me from reformer classes.
Mm-hmm.
So they've been doing reformer classes because they've been told Pilates is free. But they've found that it's aggravated things. They've ended up in pain. They're exhausted. And I think some of the categories or some of the things that I sort of say that impact on those choices is the timing. So if you're going to a reformer class, it's 45 minutes. Some places it's an hour, but it's 45 minutes. So the person is probably going to go there and feel like they have to stay there for the whole class. There can also be, as one of my clients said, I felt a little bit competitive because I was in that class and everybody else was doing something. Thought, I'm just going to push myself, go and do it. It's supposed to be good for me. And I'm like, look, I understand things are good for you. Chocolate is supposed to be good for you as well, but it doesn't mean you can eat the whole Cadbury Favourites box in one go. Okay. You have to remember that you've got to be able to pace yourself. So a class environment, so some of these pre-class programs, probably can't tailor to the fatigue needs. The other part of why I find a semi-private arrangement or a private arrangement works for these clients is the sensory modulation. So when you think about a lot of the pain syndromes or centralised pain conditions, which fibromyalgia has an aspect to it, is that there is a lot of impact on the nervous system on how people respond to pain. So having the way an environment is structured can help support the person's response to pain and situations. So if I am in an environment where I have bumping noise, bumping lights, so I'm in a gym, and there's a lot of light flashing and a lot of noise going on, my nervous system is going to be a little bit higher in oscillatory. That's just me. But I generally find in a semi-private Pilates arrangement, studios have a different look about them. Normally they don't have music, or if they do have music, it's not heavy metal, or it doesn't have a heavy beat. The lighting is probably not going to be as harsh. You are probably going to be with less people around you. So, there are studios I know in where I live where there can be up to 20 or 30 people in a reformer studio. That's a lot of people.
Oh, gosh.
I know. That's a lot of people. It's a lot of noise. It's a lot of energy. And if you're somebody who is already in this heightened escalatory state, that in itself could make it worse. Okay? So it's one of the reasons why I do that. And probably the other thing I tend to do with my clients with fibromyalgia and things like that, really try to steer groups of clients, what I call client matchmaking. So if I've got clients who I know have got fatigue and energy level issues, I might have them all in the one class. And so every person is doing their own program. But because I've got 4 people in that class, I can go, Julia, could you just wait 1 minute while I'm just handling this? In other words, I'm giving Julia permission to just stop and allow herself to manage her fatigue without making a scene about it. Okay, so it's even.
Yeah, and also it allows that person to feel normal. Like I'm in a room of my own people who not only understand how I feel, but I'm not the standout of not being capable. So it gets rid of that competitiveness or that feeling out of place.
Exactly. And I have clients, I've had a few times, a couple of clients just started crying.
Mm-hmm.
And because they've been so exhausted there. And I put them in that particular class because I know that the people in that room will actually understand.
Mm.
So I had one recent incident, and one client goes, Carla, and I go, I'll do this while I was helping, let's call her Julia, just for the sake of today, Julia's first. So just to help Julia, they'll go, oh, okay, I'll do this. And they won't make a scene or whatever. Or sometimes they might go, oh, Julia, I so understand. Julia might be going, I'm so sorry. One of the ladies will say, oh, Julia, I so understand. Some days it's just so hard to get out of bed. And in a way, I've then facilitated what I would call peer support.
Mm-hmm.
You want to put all the fancy things on it. So, but that level of peer support and that sort of environment, community environment, actually helps validate Julia as well.
Mm-hmm.
And she feels less embarrassed about coming the next time. So again, it's all these little strategies, as you say, it's just about treating someone as a human, not as a patient, not as a number, not making it clinical. We can all giggle and still be doing something very important.
Mm-hmm.
And that level of kindness and care, the bill is what made the semi-private arrangement a beautiful arrangement for it. That's just the environment, let alone what we actually can do with the equipment and the skills.
Mm-hmm. And so when you're working with somebody with fibro, is there a way that you consider planning the session for them? For example, would you start with some nervous system regulation or some down regulation or some release work, or like what is it? What might a session look like?
Okay, well, often I will start somebody with breathing, which some people can be too much, but character's quite important. So some of the ways, though, that I do that isn't just about having somebody lie on a bed or a carriage. I'm just going to grab something and I'm going to show you an example. Is that okay?
Yeah, absolutely.
So, what I've done is become my clients have got strength and ways to try to train with it. So sometimes you might attach things to just your Cadillac with a fuse ladder or something like that. I tend to use these little couple bars or Velcro straps that you could get from places like from the Momentum World, and you can attach them like I get at the end of my belt strap. Or you can grab your straps, your hand loops that you put your hands in on a reformer, and you loop it over. And then you have this D-loop that I attach springs to. Okay? And so what I generally like to do is from that, I like to attach spring. Again, if you don't have the springs, get a power band. What I like to do is I like the big fancy slings. They're really nice. So I like the softness of it. Feel like I'm with the food. But if you don't have one of these, you might grab the foot bar, the foot safety strap off your reformer. But if you are going to work with clients like this, my suggestion is to get one of these sorts of slings. Okay? It can play two different things. What I do is you'll just say, I'll just put that under my ribs. And this is going to help encourage my lateral breathing. So I'm just going to stand there and just breathe in and out. But then what I can do, I'll just do this in front of you so that you can see. What I do is get my clients just to rock from toes to heels, letting the sling support you. It is so relaxing. It is so relaxing, but also that sense of the fall helps stimulate some of your vestibular responses. So there's some vestibular responses will then help you just support your back extensors. It turns the back extensors on, which helps support the back. Or it helps somebody breathing. So it's got this beautiful calming process. So those clients who can't stand, I get them to sit and do this. I might get them on the wonder chair. I mean, I have clients with fibromyalgia, but I also have clients with Parkinson's disease who I will do this with while they're sitting on the wonder chair as a way of calming their system down to bring them into this really nice space and support their spine. By getting that nice sort of movement as well, it helps them get out of the grip strategy. And we all know what we're talking about there. Is that, turn your core on. And there's this tightening, this squeezing. Okay. We don't need to go there. So I will often have little stations around the studio where I'll have some slings set up. Some people might do it supply. A lot of people either do it standing, whatever. If they can, I then encourage them to have a set up at home. Maybe not with the slings on that. I might get one of those big power bands. Not as supportive and sort of womb-like, but it still means that they can do some of those sorts of things and bringing the focus into that deep or lateral breathing technique. Okay, part of that process of helping to calm all of the vagus nerve system. That's a whole different process.
All right. So for those of you who, like, we're on YouTube now, right? So if you haven't seen this episode on video, jump on YouTube and check it out. But for those of you who are listening, the idea is Carla uses these slings, but you could use, like you say, one of those big body bands or even a long TheraBand and tie it onto something or hold it as the therapist and allow people to practice their lateral breathing, but also this almost like swaying in the wind feeling. If you haven't tried it before, you can really feel it start to regulate your nervous system. And is it fair to say that is part of that, you know, people who have fibromyalgia, they've been in this long-term stress response. So is it fair to say that they're a little bit stuck in that fight or flight, and having something around your body like that sense of security, but then that kind of swaying backwards and forwards, it just starts to ground the body to settle? Is that what you find?
Yeah, and you know, when you stop and think about that sort of grounding or that settling feeling, think of sitting on a swing. You've got kids. Sometimes my husband says, she's gone with the swings in the park. There's a really lovely sense of calming as you just go back and forward in that process. And you watch it too. If anyone who's had children, what do you do when a child's distressed? You stand there and, you know, sometimes I've seen myself standing in a line somewhere and someone's got a baby and already goes to straight.
You're already doing it with them. Yeah.
There's something truly primal about it. So I might use that as a strategy. I might start the class that way, or I might use that in my class as part of the fatigue management.
Okay.
We may have done a heap of things. I'm not going to say, if we keep going, they may push themselves over the edge. So let's give them a little break. And I'll get these slings out. They go, oh, goody, it's the sling type. And every few minutes, they're practicing their breathing, they're calming their nervous system down, but it also allows them to give themselves a little bit of a peace from that exercise and that load and resistance work that they've been doing. So again,
there's all different strategies. I'm not saying there's one way, but thinking about how do you use these springs or slings or whatever you can to get breathing and that rocking sensation. Like sometimes my son think they love to roll like a ball because they do it. They do it and they go, this is so much fun. And it makes them think there. And it's a hard exercise. But that beautiful rocking sensation, I always like to teach them seal puppy as well. So that and then I make them make the sound for seal puppy, like, makes them happy, makes them giggly, and it's something they can do at home. And then there's sometimes you're not going to get it to them, but I find it's an exercise that if you teach people how to do it well, it is a great exercise for them to calm their nervous system, build their strength. So that's one of the things. The next part of what I like to really focus on when I'm working with these clients with this sort of condition is I like to bring the focus to a lot of the proximal work. And I like, in other words, close to the shoulder, close to the hips, because a lot of the same syndromes that you're going to be talking about are in this area. So I will get them to do a lot of work that is supportive of those deep stabilizing muscles. So we'll be talking isometric work. So it might be just having them press their hands on the wall. 4-point kneeling work. All of that to help them organise the limbs. So I'll give them these options. Sometimes I like to do some options, especially if there's overlap between the fibromyalgia and some of the other arthritic conditions like psoriatic arthritis or things like that. Because especially I say psoriatic arthritis because I really do notice this is a big problem for a lot of clients with psoriatic arthritis. And remembering that a lot of people with psoriatic arthritis will also end up moving on to some of the spondyloarthritic conditions. So it's going to have some impacts on their spine. Sorry about all of these words, everyone. I'm happy to share any links to people need. What I would generally do then for people in these scenarios is not only will I get them to do their 4-point kneeling where they're doing a lot of closed chain work on the reformer like knee stretch because I can get that sort of movement. I will also then get them to do something like the cup to arm series. So let me check all the cup leg series. Mm-hmm. So what I do, and these are really nice things to give people to help them activate their shoulders, okay, the deep rotator cuff muscles. Sorry, let me, just bear with me, but much easier if you've got someone doing it for you. So I just got like a cup with Velcros. You don't have a cup with Velcros, just get your reformer safety strap again. And I want you to put it as close to the joint as possible. Not down at the elbow, but, up there at the shoulder. And what I do is I generally use a string. If you're at home, I would then use a power band or a TheraBand that you would attach close to your shoulder. Just going to put my string on there. And what I do is I'm going to do a whole series of exercises that have given you this little bit of resistance or pull. So it can give you that sense of making you get the muscles working effectively, but not loading it so that the muscles go completely exhausted. Now, I'm going to show you what those exercises are. We call this the Hungry Preach series. Okay, so I want you to imagine that you've got the spring on there. The first thing is I'm going to rub my tummy. Okay, so it's a small amount of movement. and you've got this spring coming from behind you. I'm hungry, so you've got this small little work on your rotator cuff. Oh, I'm hungry. I'm going to open the fridge door. So I would never open the fridge door if myself was hungry. And so now I'm getting into things like my sonata as I rotate and open there. Then I'm opening that, I've got that load. Ooh. Fridge door's open. I'm just going to grab that bottle of whatever beverage you want out of the fridge door. Then I'm going to bring that in and put that. So I've got this load coming along and I've got this nice sense of control on my shoulder. Small, isometric, but also there's a level of eccentric work there to help support control. And I want that eccentric work to help get that muscle and tendon to be working in a controlled way. Really important if you've got fibromyalgia combined with some of these other deconditioning conditions, such as psoriatic arthritis, that are going to impact on your tendon. Because again, you don't want them to go, they're completely deconditioned, go and do all of this like activity, and then all of a sudden, now I've got a tendon problem. It's one way to break the spiral. Okay? But sometimes that might be too much. That might be already too much. So what I'm going to do is I'll go, okay, let's go back one step. So we're playing a game here. And I will get them to do a little bit more isometric work. The same movements, but isometrically loaded. I'm going to get you an example. I like to use like a small small foam roller or a yoga block. You can use a big foam roller if you have one. Okay. The reason why I probably go smaller, less load, somebody to control. Okay. So what I'm going to do is rather than the person that has to use the left of my legs too much. Sorry. I'm just going to put the foam roller behind them and get them to press their elbow straight to them. So it's the same idea. Here I am. I'm just going to get some small movement, but I'm getting them to focus on pressing and activating at the tendon of the joints. So in this case, the tricep tendon, to help create that pull and control of the shoulder. So again, small movement, not a huge amount of load, but helping the joint organise itself. And in so doing, you're getting these proprioceptive messages of this is safe movement, all very important for pain centralisation work. But it also allows the joints to go, okay, this is a safe spot, here I am. I then might work towards that by then adding more load and control. Gradually. So, and you'll see that I'll do a lot of upper limb work. I will do some lower limb work, definitely. But a lot of the syndromes that also go with fibromyalgia often relate to headaches and neck pain. That was one of the formal ways that they were diagnosed. And so then I'll see a lot of stuff going on there. So I want to actually help normalise and strengthen the body to start with. I'll respond to questions too.
Mm-hmm. So are you generally like, you know, so what I'm hearing is you're looking for good joint placement or improved joint placement, good proprioception or improved proprioception, working the muscle eccentrically, and learning how and when to load up so that you're managing their fatigue as well.
And there's some other ways of describing that is breath, alignment, centering, control, concentration and precision. You might have heard of those terms before.
Oh, so you're doing Pilates.
But the terms are there. But sometimes we have to go back and really think of what those terms mean for the individual in front of us.
Mm-hmm.
And as you say, for this particular client group, they have a need to control their nervous system. They have a need to normalise what is pain and what is normal movement. And so teaching them that alignment, and that they have a real need to be able to control the load. And let's face it, Pilates equipment is the most amazing way to control the load and our response to gravity.
Mm-hmm.
And if we understand how to use that apparatus, not just understand repertoire, and play with that apparatus and play with our repertoire to support that function, I think, I've seen great results for clients with fibromyalgia, great clients, and not only great short-term responses, but also great long-term results, as in they finally found a system that supports them and understands them. And they make real commitments long-term. It's not a 12-week intervention for them. This is something that they're there for the long haul, because it's made a difference. And I do have clients who have started with me at 15 minutes and they do an hour plus.
Okay.
And they get upset when they miss their hour plus.
Okay. And what does that timeline, what might that timeline look like, moving somebody from a 15-minute class through to being able to sustain a 1-hour class, allowing for potentially some regressions along the way? What does that look like in your studio?
I wish I could give you an answer, but it's not a week. Okay? I think the best answer is going to be your client.
Mm-hmm.
Okay, I will always, even if they're only doing 15 minutes of exercise, I try to get them to half an hour using breathing strategies, the slings and things like that, so that it is a full half hour. And I check in with them about that. You told me, we've done a half hour. Where are you? And we get them to check in on where they're at, because what it means is they also start to understand their own body and understand that, actually I am able to do half hour of activity without going backwards. So they can then transfer that from my Pilates class into their gardening. I can't tell you the number of my clients who do extreme gardening. They're there and they come back and I'm going, well, did you really have to do 6 hours in the garden? No, but it was so nice. I'm going, wonderful. So I want them to do that, but I want them to be able to check in. So I'll say to clients, look, I'm happy for us for the next 6 weeks for us to see how you go for a half hour. Let's check in at the end of 6 weeks. Each week we check in. How did you feel after your class? How did you feel the next day? And that is a big thing to us, because they may have walked out feeling okay, but they could be absolutely shattered the next day. And this is where I talk to them about, okay, let's start keeping a little bit of an activity diary. Okay, is it the Pilates that's exhausting them? Or is it because they felt so good after Pilates, they decided to go and do this. And the more we can work with our clients, start to build more manageable expectations and progress their Pilates in conjunction with everything else we do, I think the sooner we get a long-term result for them. Does that make sense? So you remember at the beginning, I was talking about my timing of my classes. I am going to be collecting information from the clients about how they feel, what they're doing, and seeing if we, some people call it education. I like to call it collaboration. And allowing them, by writing it down, keeping this little journey going, oh, wow, I am doing a lot. And that might be a realisation is maybe I can cut down, or it might be a realisation is, oh my goodness, look how much I can do now compared to what I could do 6 months ago.
Mm-hmm.
And, you know, sort of getting them to keep that journal and that reflection can be a good thing. So I would probably say, depending on how deconditioned the person is my answer to you, how long it's from half an hour to an hour. If you've got somebody who has been battling this for at least a year, I would say you've got at least a year of progressing them through to get back. It's going to take a long time for them to build up that condition.
Mm-hmm. Mm-hmm. And what does like, you know, if you had a session with somebody, you know, and say like you did work them too much, and you have already said, you know, like you want to know how does a person feel the next day, what does it look like? What is it like for them if we do too much with them too soon before we've put in those strategies of them?
Oh, it could be a breach of trust.
Mm-hmm. Mm-hmm.
Yeah, I would say for some people it's a breach of trust.
Mm-hmm.
They haven't there, and so I always say to them, look, if I observe where they're going, and I'm saying we've done a lot today, and I'm really open with them at the beginning of the class or at the end of the class, I'm saying, you've done a really great job today. You've achieved so much in this class, and we've ramped this up. And they'll go, yeah, I know, I can feel that. I'm going, so you're feeling okay now? Yeah, okay, that's good. That's the progress. Let's check in how you feel tomorrow. And they'll generally send me a message going, oh dear, I went too far. Way too far. And I'm like, it's fine. We know what we can do. We can just take it back a bit. And that's why having a plan. Like I do run a 12-week plan for somebody, or sometimes some clients I do a 30-week plan. But you can sort of go, okay, well, let's get back on this. Mm-hmm. Push this a bit further. But you're creating a commission structure with your client. You really are working with them and you're building the trust, because the more you can create the trust with them, the more likely they are to accept that there are going to be setbacks and not be discouraged. So that's where I find a big problem for a lot of people is they get so discouraged, they go, oh, nothing works, and then they give up on that. And what we want to say is, well, actually, don't do that. Let's see if we can see where you are. You know, maybe in 12 months' time you can go swimming again. Work with them. And it's not me manipulating them to stay with me. It's me working with them to build their trust, their relationship with their body, to have these opportunities to start pushing themselves and adding more to it. I mean, we want them to have this functional engagement and participation.
Mm-hmm. Mm.
So I get a bit preachy on it, but it's just really quite lovely to see it when those clients just make those steps.
Yeah, for sure. And then so long term, working with somebody with fibromyalgia, is there a point where they're like, okay, I'm good now, you know, I'm recovered, or, you know, or is it a matter of them learning to, now I can hear what my body's telling me, now I can self-manage, I know, you know, where I'm at, or is it a bit of everything?
I would agree. I think for some people, yes, it's just that was the phase they were going through. It may have been a 5-year phase, but it also means that they're also very aware that they're vulnerable to going back that way.
Mm-hmm.
And this is where you start to see them making changes in their lives, about understanding and stopping and taking time to listen to what's going on. I feel like if I've been able to help them do that, then our work is a success, because they've understood some of this chronic syndrome, some of this pain, this didn't arrive in one day. It wasn't a trauma-related incident. It could take years to build up to this. Generally what they've done through things like Pilates is they've managed their deconditioning, so they're no longer as deconditioned, so their body can actually cope with things. You manage some of their pain response and their pain centralization response, so they're much more understanding of what is good pain, what is bad pain, and then manage their anxiety response to that. And it's help them find good, healthy habits. But probably the most important thing out of all of it, that you've actually given them control back. And I think that's the thing we have to remember with fibromyalgia. As we said at the beginning, so many people have been going, why? And they feel like they have no control in their life because this series of symptoms and medical appointments have just pushed them into this really awful, sometimes quite a dark space. Now all of a sudden, I can do these things. Oh, I can observe what's happening in my body and I've got power to step back and do that. I think that is probably the true gift of something like Pilates for people with fibromyalgia.
Yeah, that's all really helpful information. Now I know that you've got your Substack where people can find, like, you know, your latest musings and articles and everything. Is that the best way to find you these days, is your Substack?
Yeah, I have taken a deliberate choice to put content on Substack, largely because it has meant that I'm not getting scraped by AI. But it has also meant that I've had a lot more, I'm giving myself more time to really do detailed articles. Like, I've always got very detailed articles there and detailed content, but it means that I'm sort of creating like a little encyclopedia for people and trying to make it as sort of as affordable as possible. And I try to offer live events for people once a month to be able to ask questions and explore things as well. So again, I'm happy to share if people have questions for you from this, I can keep an eye out, but I'll also share some of the Cochrane reviews, some of these forms as well, so that people can have a look. And it's okay. It's okay. We've got this. Yeah.
Yeah, I feel like we play such an important role as Pilates educators and, like you say, collaborators, if we just take time to listen to what people need and never just assume, you know, that they're coming in to do repertoire. People end up finding Pilates at the end of a very long journey of not being listened to, not being understood, and people end up putting a lot of trust in us. And it's the least that we can do is actually listen to them and learn from their body what they need.
And so make Pilates not just their happy place, but their safe space.
Yeah, hands down. Yeah. Thank you, Carla Mullins. You're a wealth of information as usual. Thank you for joining us.
Always happy.
I'm sure we will speak again on the Pilates Lounge podcast.
Are you editing this after this?
Yeah, I've got a beautiful VA in the Philippines who edits all of this for me. But you know, we keep it pretty raw. I don't like anything too polished, you know me. So
okay, no, that's okay. I'm going to ask you for some help on that, but I'm just going to quickly, I'm going to show you one